Hello everyone. Now we're going to look at some behavioral health data specific to Rhode Island. Being able to understand these statistics at a local level is one of the strengths of community health workers because it provides you with the ability to really create those connections between the system and the people served. Let's get started. In 2016, the Hospital Association of Rhode Island conducted a community health needs assessment. They identified and prioritized these community health issues. Top priority being mental health and/or substance use, then diabetes, overweight and obesity, access to care, heart disease, cancer, specifically breast and lung, and asthma for adults and children. This community health needs assessment captured the voice of community members, allowing them to prioritize these health challenges based on their experiences. This is really important because we gather this information to identify gaps in service delivery. Without getting that community voice and including it in the process, we're missing out on what matters most to the people served. We also want to justify funding streams for addressing particular health concerns. We need to rely on data to be effective in being able to create sustainable programming. So this is another extremely important part of the process. We also want to promote the creation of new programs that better serve the community. So by identifying these particular health concerns, we're really shaping the future of both training and service delivery. So think about it for a second. If we were to conduct this needs assessment today, do you think the results would be any different? Why or why not? The next step in a community health needs assessment is to look at, do those priorities match up with the data that we already have access to? So compared to the greater US in Rhode Island, we have among the highest rates of substance use disorder. We're also second in the past year for illicit drug use or alcohol disorders at 10.4% of the population. Also ninth in non-medical use of pain medication. So when we look at that, we're really starting to see, yes, when we capture the community voice and allow that capacity to exist, a lot of what people are seeing in their communities that are health concerns are absolutely matching up with what we'd understand at a systems level is a major concern. As you read through the statistics on this slide and the next, start thinking about if you feel this reflects the experiences you've had in your role. Does your patient or client population express an interest in seeking services for mental health disorder? Do you feel like there's perhaps more people than identify that are experiencing mental distress? These are important things to consider as you think about how effective your practice is as a community health worker. Are you able to engage people experiencing mental health? And is your organization set up to provide the supports and care that people need? So behavioral health disorders are like diseases. They have symptoms, people seek treatment, and people go into recovery. So why is it important to equate behavioral health disorders to physical disorders and diseases? Well, because it helps to validate the impact of mental trauma. It helps people to see addiction as more than just a habit. It reduces stigma around mental health treatment. And it recognizes the need for greater organizational resources to appropriately practice both acute or short-term and longitudinal or long-term behavioral health care management, which will in turn promote a skilled recovery-focused workforce. These expanded resources can result in a multidisciplinary approach to implementing care management, which would include, you guessed it, community health workers, the very people who are there to help identify a lot of these challenges in the community in the first place. In order to begin understanding why those statistics are so alarming and why it has been so challenging for people to embrace behavioral health care at the level needed to properly address those high percentages of people affected by behavioral and mental health disorders, it's important to consider the impact of stigma and the attitudes towards those with behavioral health disorders. The Center for Disease Control and Prevention, Substance Abuse, and Mental Health Services Administration conducted a study in 2012 that found most adults, over 80%, in states surveyed, agreed that mental illness treatment is effective, but substantially fewer adults, 35% to 67%, agreed that people are caring and sympathetic to people with mental illness. It also found that non-mental health care professionals regarded people with a mental health disorder as significantly more dangerous and unpredictable than did mental health care professionals. What this study tells us is that there is a wide gap between accepting that mental health treatment is effective and feeling comfortable accessing that treatment. That gap is filled with fear, misunderstanding, shame, and other barriers to connecting those who need help with those willing and trained to provide it. As community health workers, helping your clients to navigate through that gap can be an incredibly impactful focus for your role. To further understand stigma, stigma is defined as a mark of disgrace associated with a particular circumstance, quality, or person. And stigma consists of three elements: the problem of cognition, or stereotyping, the problem of attitudes, or prejudice, and the problem of behavior, discrimination. Think about how this affects you in your life and how this affects you in your role. Think about stigma in terms of different things within society and the social constructs we discussed in the last module. And also think of stigma in terms of our healthcare system. We'll be discussing these in further detail at our next Zoom class.